Thank you for coming back to my channel. I'm Stephanie if you're new here. So I thought I would share this with you because I went on the internet and I looked up all this stuff on knee scoping and the things that I needed to get done for this surgery, and I didn't find a lot of stuff. I found a lot of aftercare stuff. I do have a friend of mine that I work with that just had both of her knees done and everything went well, but nobody really talks about the whole process. So I thought I would share that with you guys in case anyone needs to get it done and you're just wondering what it all entails. I'm going to share all of that in today's video as much as I can, and I'm just going to make it from me today going into my initial pre-op appointment and then my follow-up and maybe even some therapy. So today I just got back, so I'm still in the van, but I just got back, and my pre-op appointment was just to go over medications and things that I need to do the day before. So another thing that I want to share with you guys, I got my wash that I need to do. So the night before surgery, I'm going to go in Monday afternoon. So Sunday night, I will take a shower. I will wash with the cleaning stuff that they gave me, and I wash with the night before, and then the next day I still need to take a shower and I need to wash with this, and I need to bring clothes that are going to be like extra raggy and stuff to go home with. So that's about it. So that's my pre-surgery stuff that I need to do. I will probably record the night of the surgery to let you guys know too how I'm doing a couple hours after surgery, and then right out of surgery I might even have Lauren record me coming out of surgery and just see how I feel. I want to be able to document everything because like I said, nobody shares anything when it comes to stuff like this, and I want to be able to share it with you guys in case you guys are nervous and don't know what to expect. I'm going to share all that with you. So with me having issues with anesthesia, I was able to get some patches, which I need to go pick up. So I'll wear a patch behind my ear for like 2 or so days if I need it. That's only with medications because I can't be on certain medications. I get sick from certain things. So I'm hoping that this patch will kind of take over some of that. Also, I need to pick up my pain medicine, which I'm getting a lower dose than maybe some other people because I can't take certain things. So usually I can take ibuprofen, but that's about it. And she's afraid that if the ibuprofen isn't going to work for me, that at least I'll have something else. So I'll be getting a Tylenol prescription, and then I will be getting another nauseous medicine that I can take if I need it during any of the time with after anesthesia. They will also be giving me more nausea medicine during the procedure, and hopefully all of that will help with me getting sick. I'm going to be getting dropped off. I'm pretty sure that Lauren's going to stay with me. The younger kids are going to go by my daughter's house, and it should only be a very quick surgery. It's nothing. This isn't, I'm not getting anything repaired. I'm just getting things taken out. So a little backstory. Last year in July, we just got a puppy, and I put a baby gate up in my bedroom area so she wouldn't go in there, and I tripped over the baby gate and I landed on it. And ever since then, I've been having problems with that knee. So I went in and had MRI done, and the MRI shows that I have just minor cartilage damage and some arthritis. So that's what we're going to repair. He's just going to go in there and scope it out. And the guy that's going to do it, we know from our church, and he's a missionary and does all these kind of things anyway. So I'm pretty trustworthy with who we're going to get. So that is going to be Monday. We are on Friday. I'm going to take off of work that night, and then I'll recover for the week. So the recovery part of the surgery is going to be, I'll be going home right away after. I'll be able to walk, and I'll be able to do whatever my body will let me do. After surgery, I am going to have to sit on the couch for 2 days. So I pretty much, I mean, the kids are pretty good as they can help and do stuff, and I have food on hand. So I'm not really worried about that. I'm able to walk and get up and do what my body lets me do. So that is going to be the initial day of surgery. And then all they're going to do is go in and scope out some of the cartilage and then some of the arthritis in that knee. So for me, I'm not in extreme pain with this. It's just more of an irritation, constant like nagging in my knee, the ups and downs and all of that. I did do some therapy before I decided to have the surgery done, and that was just more or less like strength training in my thighs and stuff just to support that knee. So I did all of that. And then I did initially have a cortisone shot in that knee, and I had some swelling and stuff in my knee. That was last year, and that took care of the swelling part of it. So I right now just have all the annoyance and stuff like that. So with sitting and standing, I can walk and all that feels good, but it's just the getting up and down that's a pain, and then driving also can be kind of annoying. So they're going to go in. He said it's only going to take about 10 minutes for the surgery, and then I will go home. I'll sit on the couch for 2 days unless I can get up and walk, go to the bathroom and do minor things. Now, I probably won't be able to do like all the animal stuff just because we have gravel driveway. We're on a little bit of a hill, unsteady ground, all that kind of stuff for the first couple days. So another thing that I'll have to do is wear in the compression socks for 2 weeks, I guess. And then I'll take baby aspirin 2 times a day for 2 weeks just for blood clotting. After I take off my dressing after 2 days, I'll have a full leg dressing. And then after 2 days, I'll take a shower. I'll be able to have that removed, and she said when I take a shower I have to wear the waterproof band-aid so that my incisions don't get wet and stuff, and then I take them off after the shower and let them dry out. So I'll be doing that, and then I need to wear a knee brace for 2 weeks or so for the swelling part of it, and then the compression socks. So I'll go through all of that, and then as I go through the whole process and recovery part, I'll fill you in. So this video, I'm hoping that I can kind of condense it so it's not so long, but it'll give you a little understanding of maybe what you'll go through if you have the same thing. So I'm not getting anything repaired, so that's going to be a different, recovery thing. I'm just getting things taken out. So it's more of watching for like blood clots and different things from the surgery. But otherwise, once I have it scoped out, my knee should be back in order and everything should be fine. And then I will do therapy for, I think it's like, I don't know, over maybe like a month or so, a couple times, 2 or some a week. My first therapy will be Friday, so I go in Monday, have the surgery, and then therapy will be Friday. And then I can't remember when my follow-up appointment is, but I'll take you guys along for all of that. But I thought I would share it with you because honestly, I looked up everything. I went on TikTok, I went on Facebook, I went on TikTok, I went on Pinterest, and I went on YouTube and I looked up other videos, and no one really shared their personal story of how the whole thing went. So from my understanding, the surgery is pretty straightforward and nothing to worry about. It's just, I wanted to know, like, I have a lot of kids in the house and I need to know, like, how am I going to run the house if I'm not able to walk? Can I walk? Can I not walk? So it sounds like I can pretty much do everything that I was doing before. It would just be more like the animal stuff that I would have to watch out for. So the first 2 days, crutches or a walker if I need it. And I will share all that with you guys. But if you guys want to know everything that happened, continue watching today's video because I'm going to share all of that today in today's video. Okay, so I went there, had the IV put in, and then we sat and waited for them to come and get me. We went and back. The doctor that I had for my knee scoping was someone that we knew from our church. And so I probably wouldn't get the surgery done if I didn't know him. So I ended up talking to the guy that was doing the surgery, last minute kind of thing, discussing that should I wait even though I was checked in, should I wait to have it done? Is it something that I need to have done? So he didn't quite know if I tore anything in my knee, but on the MRI, it didn't look like anything was extremely bad. It's just I had the tearing and then arthritis. So some of these don't even need to be treated. But because I did all the therapy and nothing else was working, I still felt like just getting up and down, like upstairs and with the kids, like sitting and getting up, that was kind of a bother. So they just went in and scoped the area that was tore and then just cleaned out my knee and stuff. But for today, I am crocheting Evelyn a little bunny. So I got some stuff started right here. I did some socks. Crocheted some socks for my sister-in-law. I'm gonna make more of them. And I have my yarn for the next set. And then I was gonna make a little pair for Evelyn out of this pink. So that's gonna be cute. But that is everything for today. This is just a little update from Monday from surgery time. So that is everything that I can think of that I had to do. One of the things that was kind of funny is that they have to do like a urine sample before you go in. And I didn't really know what it was, but the anesthesiologist, knowing how many kids we have, he ended up doing a pregnancy test quick just to make sure I wasn't pregnant. So I thought that was kind of funny. So not pregnant, but so that was the only way that I could, or that's the only thing that would have stopped me from having the surgery done. But so we'll see how the healing goes, but this is day 3 of healing. It was time for me to go in back. They like strap down your arms. So that's the one thing that I remembered. And then the anesthesiologist knows my husband, and my husband done work for him in his house or whatever. And then his wife and also him with some of my epidurals that I had with my pregnancies. I had his wife too. So we know him, and he was really good with some of the stuff that I needed. And because I had a headache, I was like questioning if I should have anything for that. And he was going to give me something, but it would have been something that, that would have made me kind of drowsy. So I refused to do that. And then, so I was in the surgery room, and then I came out, and then that's when I was like eating crackers and drinking, which was weird to me because I was completely out for that period of time. And then after the nurse asked if I could get up and stuff, I said, yeah, sure. So I walked to the bathroom. I put my clothes on. Well, she helped me put my clothes on. So I can walk on it, no problems. So it wasn't until this morning, which is Wednesday morning, is when I finally took an ibuprofen or 3 ibuprofens at 1 o'clock this morning because I couldn't fall asleep because of the pain medicine, like the pain blocker or whatever it is, wore off. But otherwise, I didn't take any pain medicines. I haven't had to take anything yet today besides the one this morning. And then it's just resting for 2 days. And now tomorrow, I have a chiropractor appointment, but I don't know if I can get there yet because I didn't take off my bandage yet. That's all tomorrow. And then Friday is my first physical therapy, and then we'll see how that goes. I am planning on going to a movie with my sister and my cousin Friday night. So I'm hoping that I can do that. If I can't do the stairs and stuff at the movie theater, then we probably wouldn't go. So we have that going on. The kids are doing some homeschooling. We have, we have the chores and stuff. So the kids have been doing a lot of the animals and stuff. And then Lauren's also helping with some of the stuff. But yesterday, I ended up just sitting and fixing some of the kids' stuffed animals and some clothing and just getting all this stuff done that was put off to the side for a while that I couldn't get to. So I did that all yesterday. Today, it's like 2 o'clock today. I just did a Walmart delivery order. So I just did that. I was able to stand just a little bit for that order. And then that will be out sometime But this video might go a little bit longer because I don't know how much I'm going to put in one video, or I just like do this video and then just add 2 different videos, like, you know, week 1 or week 2 kind of thing. So that's what I'm going to try to do, Bambi, because otherwise it's going to take so long for me to get this video out and share everything with you. I can just do little ones, I guess, little videos on updates, and then I'll post on my community tab also, all of that. This is what my leg looks like today. I did post a picture on community tab on how thick my knee padding is on here. I am able to move it. I gotta do exercises, lifting it up and down and just moving my feet around. So I've been keeping up with that. So far so good, I guess. Better than I thought that it was gonna be. And we'll just see how the next, you know, couple weeks go.
They are kind of puffy.
Yeah, that one does.
Want me to take that off?
No, just keep that on there. Okay, so I just had Evelyn take a little video, but this is what it looks like. So I'm on day, so we are Friday. I had it done Monday, and then I just did some of the exercises that I need to do. So I got some bruising and stuff right here. Not too bad right here, but she said that some of it might go down, some of it might come up. But this is what it looks like for right now. And I do have a stocking on still. Have one on this one. This one can come off. But she's going to bring me something that I can put on, like a different brace or whatever, because I was using that on there, and then I had a different brace on that was too tight, so I had to take that one off. But she's going to get me one that is something that I can put on top of all of this. All right, so we are on day 5. Today is Saturday, and I had the surgery done Monday, and yesterday was my first therapy appointment, and she cut me out this band that goes over my knee. Otherwise, I was wearing the white compression socks, and she said I didn't need to wear them anymore, that I could just wear this one, and this one works as a brace and a compression sock. So this comes all the way up here, and then if for some reason I get extra swelling, then I can go back to the regular white ones and use the wrap to kind of control things. But for right now, this is okay. So this is day 5 of what my bruising and stuff looks like. This is my stitches and how they look. I was able to take a shower and stuff, so I am going to take another shower though, and then see if I can kind of wash off some of this stuff. But I was able to like clean up the stuff that they put on. before surgery. Just what it looks like. I will keep posting as the days go by, but for today's video I'm just gonna share up to today, which is day 5, and then in other videos I'll probably add more to it. Today is Saturday and I have my surgery Monday, so I'm just gonna fill you in up to today in today's video. So I'm probably gonna get this video hopefully edited today and have it out today or tomorrow. So that's just going to be like my 5-day kind of update kind of thing from when it started and then up to today. And I will probably just do some other random videos of updates throughout the next couple weeks with therapy and different things that I'm going to share with you guys. But so far today I was able to help with animals. Yesterday I took a walk down the driveway and walk back up, and then I was able to kind of help with putting the dog outside and cleaning up the kitchen and stuff and doing laundry. So when I was at therapy, she told me that I can do whatever I want. My goal is to always have movement, but if I feel swollen or things starting to hurt, then I can rest and ice. But otherwise, it's mainly just keeping everything moving, doing all of my exercises. And today I ended up taking medicine twice just because of like the extra lack of movement and doing too much today probably. But otherwise, the first 2 days were not painful at all because I had the pain blocker and I was able to move and walk and stuff and everything was fine. It was just more the anesthesia and feeling, you know, just off or whatever from having surgery, and then just tired. But as the days went, things got better. But it was I think it was day 3 and 4. So not bad yesterday. It was day 3 that was my worst day, as in I just felt really wiped out. And my cousin came over and I ended up coloring her hair here and stuff. But I was just like, that was the highest that my pain level was at. And just everything was just uncomfortable that day. So that was my worst day. Today was a better day, and yesterday was a good day. But otherwise, I think it went overall pretty well, and I think the next couple days are just going to get easier and easier. So today is, like I said, Saturday. Tomorrow we have church and I have to help, so I'm not going to be doing a lot at church, so it's just kind of, I'll just sit around maybe a little bit, but walking actually feels better with it. And then Monday night I will go back to work and I'll work 3 hours and I'll just take it easy. But I do have therapy twice a week for the next like 4 or 5 weeks, I think it is. And then after that I should be good. So, but I'll put that in another video, like an update video or something. But for today, I just wanted to give you an update from the beginning and then to today so I could get this video out. Otherwise, this video will be way too long and too much information and kind of dragged out a little bit. So I'm going to end it here on today on day 5, and then I'll just keep doing updates. All right, so that is it for today's video. So if you guys enjoyed today's video, let me know if you guys have any questions. If you guys had this surgery done before, I would love to hear your experience on how everything went. But that is it. If you guys enjoyed today's video, don't forget to give me a big thumbs up. Don't forget to subscribe, and I'll see you in the next one.